Good afternoon. I'm David Cassak from In Vivo Magazine, and it's my pleasure to invite you to this fourth in our series of interviews with leading medical device entrepreneurs from the Innovators Workbench series. In the first three of our interviews touched on three very different personalities, but three people who had similar points of background. All were in cardiovascular devices, and in fact, in many cases, their stories intersected. Tonight, we interviewed Dr. Rodney Perkins, who has a very different background. For one thing, he's not in cardiovascular devices. But even more so, I think Rodney differs from our three previous speakers in one fundamental sense, and that he's really, in a lot of respects, the quintessential physician entrepreneur, where the first three of our guests really stressed the medical device design and innovator side. Rodney, though no slouch as an innovator, really stresses the role of the entrepreneur. And certainly we all know that the medtech industry would be nowhere without the contribution of physician entrepreneurs. So with that, let me say hello to Rodney, and let me just get started by asking you to take us back through your early days. When I say that your entrepreneurship started early, it really did. You grew up in Indianapolis, and as a young kid, worked at various jobs and always with a kind of entrepreneurial bent. Tell us about working at the drugstore early on and then moving on to Kroger's.
Those were really great days. Well, I started out in actually about 9 sacking cornmeal in a little mill that was in the area, and that was kind of the first job. But later, in high school, I moved and worked in a drugstore, soda jerk, delivering prescriptions on a bicycle, handling the people that came in. And after a period of time, I had an offer at the Kroger store across the way at, I think it was 10 cents more on an hour. I think it was going from 25 cents to 35 cents or something like that. And I liked the drugstore. It had a lot of nice perks to it, but I talked to the guy, and I said I'd really like to stay, even if you could come and meet me halfway or something, and he was stuck on his 25 cents. So I went to Kroger's and was a sack boy there for a while, and then moved up as, quotes, assistant produce director.
And in that role, you did something with the lemons and limes. Tell us that story.
Well, it was very hot. This was in Evansville, Indiana, and limes and lemons were pretty good sellers at the time, but I thought if we could do a display, and it'd be helpful to help market these, and I took a glass and some cellophane and some water and lemon slices and lime slices, put it out there, and then these were sold individually or by the dozen, so I packaged in 3 or in 6 to a little bag. So it was kind of a bundling thing, and I found that you could really increase the sales by just bundling these in little bags like that.
Because they had to buy 6 instead of buying just 1 or 2.
Yeah.
And you learned the art of negotiation how?
Well, the part of the job was the regular produce guy on Saturdays would leave. He would, leave at 3 in the afternoon, 4 in the afternoon, something like that. If you know anything about the grocery business, there's so many perishables that will not hold over until Monday that those have to be sold usually on Saturday. So you'd have to pick out the ones that were going to be sold. Well, every housewife in the neighborhood knows that that's going to occur on Saturday afternoon. So they start showing up around 4 o'clock and negotiating with you on the price of Bing cherries or whatever it is. And of course, the later the thing goes in the afternoon, the lower price you have to have, because they know you're out of business at 9 o'clock. So it was a time negotiation thing with these people, and it was fun to do.
But down around to the venture capitalists to get too late in the series.
Sometimes you wish you'd taken that offer that you thought was not so great. You know?
There you go.
Right.
How did you get into medicine?
I got into medicine. I was interested in general science and chemistry, and I actually got into medicine. I went to Indiana University and went up there with my great high school friend who was sure he was going to be a dentist and an oral surgeon and dentist, I guess, at the time. We went to the field house and we were to sign up, and I didn't know what I was going to do. And I was with him, and they asked him what he was going to do, and he said pre-dent, and I was standing next to him, and they said, what are you going to do? And So, well, that sounds good. I'll take that. Knowing that, that'd just be the first year course, and after a semester I switched to pre-med.
Mm-hmm. You did a couple of entrepreneurial things too in med schools. I understood you had the franchise for selling medical supplies and bags to first-year students.
Yes, that was another enterprise. That was I took the medical school physiology course as a junior undergraduate. And I was a TA in physiology, a senior year undergraduate in the first year of medical school. And so I got to know the people in the medical school, and the guy that had the franchise to sell your little black bag and a thalmoscope and a hemocytometer and a knee hammer and everything, I got the job from him. And so I was the agent for an outfit in Indianapolis that was selling these bags to the medical students, and that was one of the things. And then another was I got a job tutoring the jocks to get them through Physiology 101, and I started giving these sessions in the evening, maybe 2 weeks before a test or semifinal or whatever it was. And I would draw these big pictures and used it very diagrammatically to explain things, physiology. And then other people wanted to come because the course for the big nursing course, the 101 course, it was a big course. The lecturer was terrible. And so they would come, and I would charge $1 a person an hour, and I just had a cigar box down in front, and so people put money in there, and I would go over all the things that was expected of them on the test. So it's always seemed to be a job of some sort.
Now, I misspoke when I said that you didn't really have a background in cardiovascular, because in fact your original focus was on cardiology, and you spent in your second year some time in the cardiovascular research lab, if I have that correct. And the reason why I raise that is because that's where your first medical device came from, the Disc Oxygenator. Tell us about that, how you got started, and why you developed that device and what it was supposed to do.
Well, I've always been interested in cardiac, in the physiology area, and so I was interested in surgery, so I got a job in the cardiovascular surgery research laboratory. And as a medical student, my job was to prepare the dogs. We were doing heart valves on a bypass on dogs, and my job was to prepare the dogs, shave them, and I assisted in the operations. But also another big part of my job was to cool the dogs down. At that time, people were cooled down before cardiac surgery, as were the dogs. And so you put them in these ice baths, and it was a very cumbersome, awkward, messy procedure. And so I felt that if you could, on the Disc Oxygenator, that's a series of discs that's turning in a cylinder with blood flowing through it, and it carries the film of blood up, and it oxygenates in this chamber. I thought that's tremendous surface area, so why not use that as a cooling surface or a heating surface at the same time? So I developed an axle that was hollow, and you could put the coolant or the fluid, the warm or hot, in. And I built aluminum discs and then had them nickel plated for the blood surface to control the so you can drop the temperature, and it worked tremendously. We could drop the temperature to whatever we wanted in 3 or 4 minutes.
Yeah, if it worked so successfully, it was never commercialized. Why was it never commercialized?
It won a research prize, but it never. I never commercialized it. I just got busy. I was under the gun in medical school. I never thought about commercializing it. It was just a project. It was to solve a need, and I wasn't thinking in a business way at all. It was just to do an interesting project to solve a problem.
And yet, you would say later that you learned a lesson from that, and that is that the lesson being close but no cigar. You can do a lot of work, but if you don't carry it through, you don't do it. At what point do you realize that, hey, you missed this opportunity that could have something? Was that something later on in life, or did you even at the time have a sense that you might have done more with it than you did?
Not really at the time so much. It was a project, and I did it. Later, I saw that had I done something else with it, knowing what I know now, I might have done something with it. But I felt that I'd done what I want to with it. I think the point is, though, that we all have ideas, and many times you sit around and you say something, you see something, you say, oh, Pat, hey, I thought of that. That's my idea. How many in here have done that? I bet practically everybody has it sometime or another. And the point is that those ideas are not very valuable unless they're brought to fruition and they're actuated and they're made into reality. And the idea is only just the core of the thing. There's a lot of work from bringing it to from the idea to where it's really useful.
It's interesting you say that, because I know that a lot of people who work with doctors as designing agents and as designing, device developers do place a lot of, understand that for doctors who are experienced with doctors, they do place a lot of faith in the design per se. And it seems to be characteristic of that entrepreneurial bent that you recognize that the idea itself is not really the key, but it's developing it all the way through. A lot of people, who work with doctors find that doctors kind of get fixated on, hey, this is my idea, therefore I should get all the credit and I should get all the value out of that. That seems to be an entrepreneurial attitude among physicians.
Well, I think as a physician, you see the end use of what you're thinking of, but it takes everything I've been in, it takes a tremendous team to do it. You may have an idea, but it takes engineers, it takes iteration, animal studies, clinical studies, the right people thinking about it, the right financing, the right lawyers and accountants, etc. It's a significant effort beyond the conceptual and the idea stage, although it has to start somewhere, and that kernel, that vision is the start of an enterprise or something, and that vision leader many times is the inventor or the innovator that has strong belief in the idea and is able to attract other people to the concept.
Do you have a sense, as you think about what it means to be an entrepreneur, what the most important character or quality of an entrepreneur is, as opposed to a designing surgeon or as a money guy? What differentiates the entrepreneur from others in that cascade of folks making things happen?
Well, I think that one of the main things in anybody in an entrepreneurial role, and I view not only the lead entrepreneur, the vision leader, as I call it in how you grow things, you expect most people to have a certain level of, I think, intelligence and integrity and those things that we value. But I think the most important single thing is passion. Is passion for the idea, passion for what you're doing, almost disregarding time, that you're focused on a problem and a solution. And I think that passion is probably the strongest element that could predict success.
Mm-hmm. Now, we say that the oxygenator was never commercialized, but that wasn't a total waste of time, because didn't you submit it to an AMA student competition? And tell us that story, because it's I think it helps to explain how you got into the whole area of ear surgery.
Yes, this oxygenator I submitted. There was AMA had a research competition, and I submitted it to there was a student section and an intern resident section, and I submitted to the student section. And actually, the competition was in Los Angeles, so I came from Indiana. I went through San Francisco, and when I went through there, I spent about 3 or 4 days there, and I said, I'm going to work my way west. And so I went on to Los Angeles. It did win the first prize, and part of the first prize was to take your exhibit to the AMA convention. And now, for a medical student, this is all expenses paid, staying at the Fontainebleau, and at the time, which was a very fancy hotel down there in South Beach. And so one day I was standing there manning my exhibit, and the guy who won the resident portion of this was a plastic surgeon. I forget what his project was. And it's kind of a slow afternoon. GPs are not too interested in disc oxygenators. And of course, the AMA convention is mostly family practitioners. So it was a little slow. And he said, say, there's a guy from my hometown over here. He was from Memphis, Tennessee, that's doing an interesting thing. He's using a microscope in the ear, and he's taking out the stapes bone when it's fixed in otosclerosis. He said, you ought to go over and see that. So I'll watch your booth for you. So I went over and I saw an exhibit by John Shea, who had just done the first stapedectomy, which was kind of a revolutionary operation, used the microscope. And so later, I was kind of fascinated by that, and I drove down from Indianapolis to Memphis to watch some more of this microsurgery. Got very intrigued by it, and finally decided to go into that instead of cardiovascular surgery, because I thought that the whole area of microsurgery and what you could see and the amount of tissue damage you could eliminate by being very precise was a field that there was a lot of opportunity in.
And in fact, your career seems to be by far the most diverse of anyone we've spoken to. But one way to explain it is that really what you're interested in solving problems through a kind of surgical process. Although you're best known as an ear surgeon, but Novacept and pulmonics are really ways of looking at different ways of looking at collagen, laser scope, different ways of looking at the surgical process and tools that can be brought to bear on that.
Yes, I think the first things that you start doing is, if you're a surgeon, surgery is instrumentation. I mean, yes, it's an understanding of anatomy and physiology and all these things, but it is instrumentation, and it will always have some instrumentation to it. And so it started out developing new instruments for ear surgery, but then in fact, the first three companies, Collagen started out to create we were trying to create a biosynthetic eardrum for implantation. Turns out the cash cow there was injectable collagen, same material we were working on though. Laser scope, surgical laser company, I set out there to find a better surgical laser for ear surgery. And Resound, which was an acoustic hearing aid company, we started that trying to develop a surgically implantable hearing aid. Now, all of these are expressions of in the area of looking at an area and trying to get a solution. From that kind of came the concept. I'd love to look at any surgical procedure or problem of that nature and think, how would you do it? I don't know how to build all the devices and all the engineering there, but what kind of widget would you need, and how could you get in there and do that and get out quickly and safely?
And before we get into Collagen and the rest of that's your career as a both physician and entrepreneur, you invented one other product when you were in medical school, as I understand it, and that's the Air Splint. Tell us about the Air Splint.
Oh, that's a sad day. The Air Splint came about in internship, actually. I was on the orthopedic service at Parkland, and then I was on the emergency service, which the emergency room there is called the pit. And when you're in the pit, you're on 24 hours and you're off 24 hours. And so I would be down there, and these terrible accidents would come in, and with all sorts of broken bones and all sorts of splints on them, wooden ones and things wrapped around and everything. And I thought, there could be a better splint. These things are messing. Many times there would be compound fractures, and there would be bleeding and hemorrhaging also. And so that was another problem in this kind of thing. And so I thought, a tube under pressure is rigid. And couldn't you create a better splint if you had something you could wrap around that was a double-walled thing that you could inflate? When you inflated it, it would become rigid. Plus, it would have pressure on it, and you could maybe stop a little bleeding. Plus, you could see the wound. And also that it could be very compact until you inflated it. And so I thought this was a really good idea. And so I started measuring arms and legs of everybody I saw, no matter what their problem was. I had my tape measure, and I kept this little book of all that. And so I had that, and I was going to statistically figure out, what the average leg size was and everything. And so the thing I couldn't figure out, though, was how you would get the valve to blow this thing up in the plastic. Now, this was trivial to any plastic engineer, or any engineer probably. And so I called this guy, got in the yellow pages in Dallas, and I see plastic manufacturing or something. I call up this guy, and he comes out to the hospital, and I tell him all about my great idea and everything. He says, "Oh, yeah, that's interesting, doctor. That's interesting." He left. Never called me or anything. I got busy and was on just finishing my internship and didn't do anything about it again. And then 2.5 years later, I was in the emergency room. I was in a surgery residency here at Stanford. I was in the emergency room in San Mateo County one night. An ambulance wheels up, and they have this guy on a gurney, and they're roaring him into the room, and I see this big balloon thing on his leg. And I says, "What's that?" And the ambulance driver says, "Oh, Doc," he says, "that's a great new device called the Air Splint. Do you know how that works?" I said, "I've got a pretty good idea." But by then I did realize that I had dropped the ball on that one. And that one was, I think, does exemplify something. Loose lips sink ships. You want to you keep things fairly tightly held until you have some protection on them or you have some advantage on it.
So I keep describing your career as a kind of steady path from this entrepreneurial young boy to the company founder you became. But actually there was a kind of turning point in your life at which kind of set the direction. Tell us about the course that you were going to take on electronics at Oregon State and your stay at Banfield by the Sea.
Banfield by the Sea. Well, after residency, I had an NIH grant to go up to a course. It was called, I think, Electronics for Scientists or something like that. It was an electronics course for non-engineers. And so it was a 2-week course up at Corvallis at Oregon State. So I went up there, but I had to go back to Indiana for something. And so I was about 3 days late to the start of the course. And I came in and I hadn't figured out what I was going to do. I'd finished residency. I thought, well, I'm going to travel around for a year and see neurosurgeons and watch their tricks or something like that. But I had no definite place for what I was going to do. And so I decided in that course, that first weekend, I got on a bus and went over to the coast, stayed in a kind of idyllic little hotel there. And that weekend, I thought, Perkins, you better figure out what you're going to do with the rest of your life here, because you got to do something very soon. And so I went back and I dropped out of the course, took my textbooks, turned them in for a pencil set and a sketch pad and a pocket knife and some things, got back on the bus, went over and spent 10 days at this place called Banfield by the Sea, and sort of just thought of what I was going to do. And so then I decided I would take off on this trip to see these neurosurgeons.
And the neurosurgeons were Bill and Howard House of Los Angeles?
First place I went because during residency, there wasn't really a very good ear surgery surgeon here at Stanford at the time, and they were cutting edge kind of surgeons down there. So I would go down on a day and I would watch them and dictate notes and write it up of how they did, what instruments they used, et cetera, et cetera. And so the first stop was to go down there. I took an apartment around 3rd and Alvarado, which you probably wouldn't walk at night now, and stayed there for several months and watched their tricks and worked with them.
Mm-hmm. And what were you there to do? I know they invited you to join their practice. Why didn't you?
I wanted to come back to Northern California. I like this area. I like Stanford. I like the milieu up here. I didn't really particularly philosophically want to spend the rest of my life driving into 3rd and Alvarado. And I thought there was opportunity up here. They were already at the top of the hill down there, and I could have gone in with them. But it was a very positive relationship, and it really inspired me to develop a very innovative practice.
Mm-hmm. You said to me once that it was at working with Bill and Howard House that's where I started that if you had an idea about something you need in surgery, you develop it yourself. You don't wait for a company to do it. And obviously, as a device innovator, that's been a driving rationale. But I wonder whether, again, pointing to this other hat you wear as an entrepreneur, are you open to device ideas that are not your own as in a role as an entrepreneur, or has virtually everything you've done come from an idea that you had or developed from some point?
No, but I've been open to other ideas. I mean, sometimes you start out with something, for instance, Novacept started out trying to create small endoscopes, 0.35 millimeter endoscopes to look in knuckles. And it ended up a women's health company. It's a long story, but they don't always start out with device. And the thing there that was very attractive to me on that was not so much the instrumentation, although the instrumentation was intriguing. It was the people. I ran into 3 engineers that I thought really had it. They had passion. They were extremely smart. Two of them were Hungarians that had just come over here, and they were shot out of a cannon. And I liked them, and I knew we could figure out something.
So let's talk about Collagen, because I think in many respects that may be the company you're still best known for. How did Collagen come about, and tell us about the early days at Collagen and how the technology got developed.
Collagen really started out of trying to create a biosynthetic eardrum. In the latter part of residency, I got me interested in homograph eardrums, and then in the first part of my practice, I worked out a method of processing them in a buffered formaldehyde solution and dissecting them and preparing them for implantation. An eardrum is probably the structural component of that is primarily collagen, and so I felt that maybe you could create a biosynthetic eardrum out of collagen. So I had in this foundation called Project Here. I had a nonprofit foundation. We had a fellowship for pre-meds and our medical students for the summer, and they could do a project and get a little paper out of it, and it was always in an applied area. So one medical student that came on board was named Ed Luck, and his dad was the emeritus professor of biochemistry here at Stanford. And he was a very smart biochemist, and he was doing tensile strength studies on these eardrums and everything. And so I said, say, do you think we could create a protein film of some sort? And he said, well, maybe we could. And so we started, instead of stopping at the end of the summer, he continued working on it. And then he went up to the University of Oregon for medical school, and I said he wanted to continue working, and I said, okay, get an apartment with an extra bedroom in it. We'll ship your lab up there and continue to support this, and you can tinker with this. A couple years went by. He was very close to breaking down collagen into the individual monomer, clipping off the TLIP peptide ends that contain the antigens and putting the sort of microfibrils back together. And he wanted to drop out of medical school. I said, don't do that, just continue this, but don't do it. No, he insisted on doing that. So he came back down here, and about that time, I was presenting to the plastic surgery grand rounds on these homographs, and I was talking about collagen and things in that, and a resident in the audience started asking these questions. He seemed very informed about collagen. His name was Terry Knapp, and he was working with a chemist here at Stanford and an oncologist called John Daniels, and they were mincing up dermis and injecting it for filling out wrinkles and things. So we had the material, they had the application patents and stuff, and we got together and we said, let's form a company, and that's how that started.
Yeah, it's interesting because both with the Disc Oxygenator and the air splints, you had had good ideas and you had passed. What made you want to form a company at this point?
At that time, I think we saw the potential of the material, and we'd had a couple of pharmaceutical companies come around and wanting to talk with us and talking with us about it, and we just decided, why ship it off to them? Why don't we do it?
Mm-hmm. So who was Reed Dennis, and how did you meet Reed Dennis?
Reed Dennis is a venture capitalist that was my next door neighbor. And in '74, I moved to Woodside, and it was '74 when we got Collagen going. We actually, '75, we financed it. But that Christmas, I was at a neighbor lane cocktail party, and I knew this guy was in finance, but I had no idea what a venture capitalist was or anybody, but I knew he financed things in some way. And I said, say, we got this little project, do you know anything about financing, that sort of thing? And he was one of the early VCs. He said, yes, well, why don't we talk? So it ended up, he was the lead and Reed stuck with that company very, very thoroughly. He did a great job as a VC on it.
Do you do the negotiations with Reed yourself? Raising money and negotiating terms is such a critical step, particularly for early stage entrepreneurs. How'd you know that nice guy you met at a Christmas party is your neighbor, but how'd you know he wasn't taking you to the cleaners?
I didn't. On that, I knew nothing about negotiation. I knew nothing about preferred shares or common shares or anything. And I had an attorney in San Francisco help me form this nonprofit foundation. And so he had a negotiator in his firm, and I said, well, would he come down? He said, yeah. So we hired him to come down to negotiate with Reed's lawyer. And that negotiation started at 7:30 one evening out of 3000 Sand Hill. It ended up at 4 in the morning. And my instructions to him is, look, try to get the best deal you can and push it to the 11th hour, but don't lose the deal. And that's how it came out.
So talk about the early days of collagen, because if I understand correctly, maybe I'm wrong, did you ever develop a synthetic eardrum out of it? Because the technology used for other applications.
Oh, when you got to looking at it from a business perspective, the market for eardrums is not that large. And so that wasn't going to be part of the go-forward thing. The first product here was that we planned was a burn dressing. And we developed a pretty good burn dressing. However, I think we'd overestimated the market size, and also the injectable was essentially pretty close to ready to go. And we got into the burn dressing because in 1976 the FDA law came in, and we thought we could get the burn dressing in, kind of since it was outside the body and may not be quite subject to all the stuff that was happening there. But as we got downstream, we changed the primary product, switched to the injectable, and that became the main product of Collagen Corporation.
It's interesting. And Collagen is an interesting company because not only did you not do what you originally intended to do, but it itself split into two companies, and then in addition had two fairly notable companies spin out from it, Target and Cohesion. Talk a little bit how the company developed and evolved.
At Collagen, we were developing collagen and collagen-based materials, and the product was collagen and things made of collagen. Well, John Daniels was an oncologist, and he wanted to lace some collagen with some cancercidal drugs and then deposit them through a catheter into an artery going to an organ that had cancer. And then he was going to extrude that collagen plug, and it would be sitting in that artery, and it wouldn't be, and the maximum dose would be gotten downstream from that. So we formed this company and did a joint venture with Eli Lilly. And what happened was, though, that the collagen and that whole thing of the cancer thing, it was okay, but developing the catheters to deliver that became the primary thing. And then it turned into a catheter company in interventional neuroradiology, and John was the one that did that. But that turned out to be bigger than collagen.
Yeah.
And it was sold to Boston Scientific for, I think, $1.1 billion.
$1.9 billion.
$1.9 billion. I'm not good at those kinds of things.
Exactly. What's 800,000 here or there, right? And Cohesion.
Cohesion was started out as a company to develop the biosynthetic eardrum finally, and some other otologic things of collagen, little device things. Plus, we had in it a tissue glue patent that we developed at our nonprofit institute that used collagen in addition to the other things you put in tissue glues. This was a joint venture between Collagen and myself. Then Collagen was the one who was going to continue to put the money in. So they continued to put money in, and they had a bigger percentage and I had a smaller percentage. But then Collagen was split into two, the aesthetic business and then the other sort of research business. And I recommended to the Collagen board that they should take this other stuff, which was now no longer the eardrum, but it was a tissue glue and sealant, and it was coming along and had great scientists in it and everything, and merge that with the other half of the entity and give the name Cohesion to that, and that was done. So they bought me out of that, and all that technology went into the other half of Collagen.
You described somewhere that being an entrepreneur is kind of like being a sheepdog, herding all the various parts together. I want to get to LaserScope, which is your next company. Before we get to that, how much time do you spend or did you spend actually running or being in the senior management team of the companies that you founded? How do you decide when to leave and go do the next thing and when to stay? Because you're also a practicing physician with a practice during this entire time. How much actual involvement with the companies that you found have you had?
Well, in the first three, well, all of them, quite a bit. But what I would do, and certainly in college, and we had other management in very early. Laser scope, typically what I would do is get it going. I might be the CEO for 10, 12, 15 people, or maybe 30, and then get a CEO, quotes, professional manager in, and then take off from there. That was kind of what I would usually do. I don't know if that's been always the case, but usually.
Oh, so many of your technologies solve complex clinical problems. Do you like the business side of it? Or do you find it annoying and boring?
I like the early stage of the company. I like the putting together the team and getting the technology, getting the course kind of set, and trying to get the whole thing together. I really tend not to like looking at balance sheets and doing the business side. That's another reason I think to bring somebody in that's good at that and that likes to do that. And so I think the answer is that part of it, no, but I like the people part and the innovation part. So
you launched Collagen in 1974. When did you launch LaserScope? How did that idea come to you, and how did you proceed with that?
LaserScope, the concept there came, sort of started before that. It started when I was watching a NOVA program one time, and I saw in a microscopic field one red blood cell targeted and a laser hitting it and just boom, vaporizing it. And I thought, well, there must be some application in microsurgery for laser or energy that could be controlled that well and have that effect at a distance. So I went over to Coherent Radiation, which was about 2 blocks from my office, and when lunchtime, talked to the receptionist, said I had an idea. She gave me to a product manager. He wanted me to do a marketing study for him, and I was busy operating all the time. And so I went back, and a few months later, I thought, that's still a good idea. I'm going to go back over there, because I had an idea of using that laser to make a hole in the stapes bone of 1 millimeter, so you can put a prosthesis in it to bypass a fixed bone. And so I went back, and that first product manager has been fired, and there was a new guy there, and he liked the idea. So they loaned me this laser to sling under a microscope. Now, you couldn't put it under a regular microscope, so I went down to Los Angeles, and a guy I had met down there that did do microscopes reconfigured a microscope. We hung this under it. We did the first clinical series. Subsequent to that, I left Coherent, worked with Spectrophysics to finalize this adapter that went under. Then they sold the medical business to Cooper. So I resigned as a consultant after 6 or 12 months, and one of the engineers there came to me and said, and this is the guy that Peter Hertzman, that said, if you ever want to start a laser company, let him know. And he had found out about a crystal that had been just declassified from Air Force research, where they were trying to develop a visible wavelength targeting laser for bombs. And this was KTP, potassium titanophosphate, which is a doubling crystal that takes an incident beam, doubles the frequency, halves the wavelength. So it took a YAG laser beam, which is invisible, 1064, made it 532 in the visible green, which is right on one of the absorption peaks of hemoglobin. So we thought, hey, this may have some really nice features for surgical laser. And so we got a custom laser house down in Santa Clara, and this guy got interested, and they crunched a bunch of numbers, and they said, yeah, they think it would work. So we started that, Bob Presley, Peter Hertzman, and I.
And who was Bob Presley?
Bob Presley was the PhD laser physicist that had this custom laser house. And so that's how we got that started.
Yes.
And that was right after Collagen had gone public. That was in '82. Collagen had gone public in '81, so I had a little money to seed that, and then we got some angels in, and then finally some VCs.
Okay. Before we go to Resound, tell the story about when you took all the guys out and had to buy them suits.
Oh, that's interesting. We, as many of these enterprises, and if you're in the medical device area, sometimes there will be times when you think the dawn isn't going to rise and you're out of business, but, and this was one of them. We had about 13 or 14 people, all engineers or technicians or technical people, and we had a laser that the box was finished and it was sort of working but not quite. We were absolutely out of money, and there was a show coming up, an ENT convention in Anaheim, and we had an exhibit space because I knew there would be application for this in ENT. So I said, if we can get to the show, and also there was a VC that was going to come to the show to see if there's a market. This was a whole new laser. Nobody ever heard of this kind of laser. And
wasn't it the first laser developed?
It was the first laser that was developed to be a surgical laser. All other lasers were industrial lasers, CO2 YAGs, and all of these others that are industrial lasers, and then they try to find a medical use for it so they can put medical laser on it and charge a lot more for it. So we said we had to get there. We cleared out a couple offices, went to Levitt's Furniture, bought some bunk beds, had dinners on the company. The guys worked very, very hard, and we were going to go down there, and so we only had engineers to man the booth. So I was saying, okay, now we'll go down there, and what I want you to wear is a dark blazer, a dark suit, a tie, white shirt. And one guy raises his hand, and he says, I haven't got a dark suit or a blazer. And I said, how many of you others do not? You know, a bunch of hands went up. I said, okay, meet me over here at the shopping center, 6 o'clock, or 7 o'clock on Tuesday evening at the store. And so we go into this clothing store, and I said, okay, now go around and find yourself a blazer and suit and tie and everything. So these guys are going around and they're coming up. Yeah, that looks good. Let's take it. So we go over to the clerk, and we have this big pile of suits and stuff there. And the clerk is just licking his chops, you know. He sees this big sale, and he said, well, this is good. He says, that'll be X thousand or whatever it was. And he said, I have these for you a week from Thursday. Now, this was Tuesday, and the show, we had to be down there Saturday. I said, well, you know, this is a pretty good order, probably the best order you had today. He said, yeah, it's good. And I said, well, we need these this Thursday. He said, oh, I can't do that. I said, well, either they're this Thursday or no sale. And he said, I'll have them for you Thursday evening. So we got those, the clothing. We went down there. The first day on the floor, the laser conks out. And fortunately, at 2 watts on a laser, you can't tell from 20 watts, you know, unless you're doing something, you just look at it. So we bribed the guards that night at the exhibit hall to let us in there. We had 3 engineers in there working all night to get the light on, because the next day the VC was coming down to go do exit interviews with the docs. So we got it pumped up. We got about 1.5 watts out of this thing, and it's cranking along, putting out some green light. But we were only burning tongue blades, so you didn't have to do too much. And so he talked to the docs, and the docs gave him a good rec, and we came back the next week, and the guy called up, and he put in $1 million, and that got us, you know, off the ground and running, and then other people came in. But that was a close call.
Your next company was Resound. How many years later did you start Resound? And Resound, actually, of all the companies you've sounded, seems like the one that's most in your sweet spot. It sounds like the one that is closest to your clinical expertise.
Mm-hmm. It was. We started Resound to do an implantable hearing aid, as I mentioned. We had a little one employee, John Winstead. I don't know if John's here tonight or not, but we were working on some models to try magnets and things in the ear. And I was looking for an engineer, and I tried to get one around here, but there weren't many acoustic engineers around. You can get a lot of other engineers, but there weren't too many at the time. So I started out on I got a recommendation from our advisory board of some people, and I started out from here, and I went to Chicago, up to Minneapolis, and I was ending up at the end of the week at Bell Labs, where I'd heard about an engineer. And I went in there, and to talk to this guy, and he had tears in his eyes, and I could tell around this. In Bell Labs, things are organized in kind of halls where groups work and everything. I could tell people were scurrying around. There was something wrong. And I said, "What's wrong?" He says, "The project's been canceled." I said, "What project is that?" And he said, "Well, we were developing this world's greatest hearing aid, and they canceled the project." That's when AT&T thought they were going to do everything, and so the chairman and the CEO said, "No more of that project." So I talked. Long story short. The next week they called up and wanted to come out because I said we might want to acquire that project. And but Resound at the time was a sound booth and a vibration-free table and a laser. And so it was in about 1,000 square feet of where I had old desks and old medical records and stuff stored. So these guys were coming out from Bell Labs. So John Winstead, I said to John, we can't let them come into this dump here. Get a sign, it says Resound, put it on the door, go over to Hinge-Hold Motors, rent a couple trucks, get all this junk out of here, leave one desk, put a pot and palm here, and that's the best we can do. So he loads all this stuff and parks it in the parking lot somewhere. And so they came, and it was a lab, but that's all we had. But and fortunately, David Packard was a patient of mine, and I called him and I said, I think we have a chance of really getting some terrific technology out here. But I mean, if Siemens hears about this or somebody else, we're dead in the water. Resound was not going to be anywhere. And he said, well, bring him over here, and I'll talk with him. So, okay, so we went over there, and we spent about 45 minutes, an hour with him, and he talked about how great it'd be to have a good hearing aid. He almost got into business because he was frustrated with the hearing aids, and endorsed that we were legitimate people, and I was okay. And so we made the deal on that. I had the right to go at any of the 18 engineers on the team that were working on it. And I hired 4 people, moved them to California, and we started sort of the second wave of Resound, which is what became the acoustic hearing aid company that was really the first to introduce high-tech signal processing into the whole field.
Did you ever know why Bell Labs was canceling the project?
Yes. It was after the breakup, and then they were going to get into computers and everything else under the sun. And they lost a lot of money that year. And so the upper management says, we're going to stick to our knitting, telecommunications, information, that sort of thing, and we're going to get out of all these other projects. They had a lot of other medical projects and things like that going on in Bell Labs. Yeah,
it's interesting, again, because Resound is so identified with your clinical specialty. Your next company, Novacept, I mean, I'm not certain it's the exact opposite, but it certainly seems very far afield. How did you get into Novacept from Resound?
Novacept came about actually from Laserscope in a way. I was convinced, and I've always felt, that the real products are in what delivers the surgical effect, or what the surgeon has in their hand. You want to make all these boxes transparent to that. And so we were in the laser business, and I was trying to get us into more delivery devices. And I felt that the next thing would be micro-invasive surgery, not minimally invasive surgery. And that it'd be the same thing, only you're going down in sizes. And so I was interested in looking for small endoscopes. And so the management, to humor me, went out and talked to people, and they turned up a couple of engineers down in Santa Clara that were moonlighting and had some nice little scopes. And I met with them, and they could build catheters. They were ex-ACS guys, and they were really talented. And I thought, well, they wanted to start a company. So I said, okay, let's do this. And so we got Laserscope to put in a little money. I put in, some others did. and we got it going. The trouble was that we developed some very slick little scopes, but the VCs felt that it was going to be too much of a missionary marketing to teach rheumatologists to do scopes and knuckles and things like that, and it was going to take too big a missionary sales force and everything. So we had trouble funding it. So we had 22 people. We had to go from 22 people to 2 people. And then I split it into pulmonics also. We had another endotracheal tube that has light fibers in it and an optical viewing channel. That went with 2 of the founder engineers and a technician, and in the other half, 1 of the founder engineers and technician. Csaba Trukai, who's an absolutely brilliant biomedical engineer and a guy with real passion and insight. He was in Novacept with the technician. And we had built a scope for a laser scope that was a neuro endoscope, but it was a great hysteroscope too. And so we tried to make a deal on the hysteroscope, and so we'd gotten into the gynecology area, and we said, look, you know, endometrial bleeding is a big problem. If you could develop a device that can minimally invasive eliminate hysterectomy and roller balls and all that, it would be a big success. So Csaba and the technician worked for months and months. We had to downsize the company. I was writing the payroll checks for months. We got a little money in, we got a little further, and then we finally got some funding in. J&J came in and developed it, and now it's, we have some other good VCs that came in, Prospect and 3 Arch came in, and Versant, and so it's well financed, and it's, the sales are just beating J&J everywhere we're going now, and it's looking good.
The J&J represents an interesting issue that we just talked with some of the other folks who've been here, the whole notion of corporate partnerships. Johnson & Johnson was one of the early investors, but then they went out and bought Gynecare, which was a competitor. And so suddenly you had a major shareholder owning a competitor. How did you deal with that situation without, getting to the ugly details, or get into the ugly details if you care to? But that's got to be a concern to a lot of folks who see corporate money as a valuable source of funding, but also recognize that because there are strategic objectives of the corporation, there may not always be a synchronicity of intentions there.
Well, that was a little bit of a problem when they did that. They had a board seat at the time, and our board this was before we had all these other venture people in. David Off was on the board, and David was a co-inventor of the technology, by the way, with Csaba Trukai, David is the founder of Heart Technologies. We talked about it, and we felt it was better if the J&J person went off the board, because there would be a conflict there. You couldn't just ask him to leave the board meeting every time we talked about something strategically. And we talked with them, and they were agreeable to it. I think they saw the potential problem too, and left the board.
Does it make you leery of taking corporate money as opposed to straight VC money going forward?
No. I think a combination is probably best in funding a company. I like early angel financing and putting some of your own money in if to get it going to a certain degree, and then angel financing, you can move faster with that usually, and at the right time, VC financing. And corporate financing can come in sometimes before. Usually it's probably a little better later, but sometimes it can come before. Usually the big companies will not take too much of a chance on an early technology development. They would much prefer to have sales, profits. They know the situation before they acquire a company.
We're getting close to our time here, so let me just ask you briefly about one other company, because you mentioned Pulmonx, which is an interventional pulmonology, but Sound ID is your latest project. Talk about Sound ID. Again, it sounds like it's back in your clinical sweet spot.
Well, after we sold Resound to GN Great Nordic, a Danish telecommunications firm, we started looking around for what else could you do taking signal processing and technology and expand better hearing to a larger audience. The hearing aid business is largely constricted through a very constricted channel, and also the prices are very high, $3,000 for a good digital hearing aid. And it's the channel and the way the industry functions. So we felt that if we could get in and do other things, develop technology that was not just like a hearing aid, but used that signal processing, that these products would be attractive to people who didn't necessarily have a severe hearing impairment, but had difficulty, say, functioning in noise. So our first product is a very techy earpiece that works with your mobile phone, a Bluetooth mobile phone, and it can be personalized to your hearing through an internet type of hearing profile assessment. So we have other products in mind too beyond that are very exciting. So I started gathering a team together, and fortunately we were able to acquire most of the Resound team, that leading team, and put other good people with them, and that's how we got that going.
Starting with Reed Dennis, who was instrumental in funding Collagen. We did not mention Eugene Perkins, who was Eugene Kleiner, who was an early investor in Resound. You've had a very interesting career raising money. It's one of the critical issues. You said that it was never easiest raising money for Collagen, but you've also said at another point in your career that at one point or another I've been turned down by virtually every venture capitalist.
That's true.
How hard is it to raise money in this environment? Now, apparently track record doesn't speak for much.
Well, it's true. I have been turned down by almost any venture capitalist you would name on one project or another. I think as an entrepreneur, though, you must not let that be too discouraging to you, because many times they will not see something as clearly, or that there's some other reason that they don't like it. I think that there are many reasons sometimes the deal is turned down. You always want to try to find out why it's been turned down. And so, because it can many times be some really legitimate thing that you're not doing that you could change easily, and it wouldn't hurt your mission, but make it better to finance. I think now, in this environment, I think this is probably the toughest environment I've seen to raise money. The VCs are kind of shell-shocked from the dot-com. They were a little shell-shocked from earlier in '96, the companies in the medical device field that went out and didn't do so well. So it's very tough right now.
You know, let me ask you one final question. We've kind of painted your career today as walking this line as a physician entrepreneur, and my experience in talking to folks in the medtech industry is that device innovators seem never to run out of ideas. They always have another project they want to be working on. But my experience is that a lot of business executives actually burn out after a while. That after they've done about 3 or 4 companies, they've kind of had it, and that's when they go the consultant or VC route. I have a friend who's a CEO who once said to me, if I ever take another job as a CEO, shoot me in the head. So that raises a question. Sound ID is your 5th company by my counting. What's next for you? Where do you go next? Have you done everything you want to do in this space, or do you have other ideas that you'd like to bring forth?
I have some other ideas that I'm working on in the ear space that are just pot boilers now, and they're not even formed as companies. They're kind of research projects. I also think that one thing that I may do, I've decreased my practice significantly over the past couple of years or so, is perhaps I like the early interaction phase, and maybe do something where an entrepreneur with an idea could come, and maybe I could look at it and consult with them and say, oh, well, this is how I would develop it if I were you, or these are the things to do, and maybe become involved with them, or maybe not. But to try to, in some way, maybe broker ideas of young entrepreneurs, because many times they have the ideas and the technical savvy and the clinical understanding, but do not know quite what the road might be to development.
You described passion as the key ingredient of an entrepreneur. Do you still have the passion to be an entrepreneur?
I still love doing it, and it's a lot of fun, and it's great fun working in all the companies now. I mean, I'm the oldest one in the room usually, and there's so many sharp people, both clinically and engineers, and it's a lot of fun working with them and trying to develop these ideas.
Well, Rodney, as somebody who's gone from Collagen to laser scope to Resound, I can't wait to see what comes out. Thank you very much.
Thank you.
Hi, Dr. Perkins. I'm Dr. Larry Fan, a student of the Biodesign program and a plastic surgery resident for UC San Francisco. I was wondering if you could talk about the importance of surgery and patient care in your career as an entrepreneur. Also, what advice would you have for young physician entrepreneurs about balancing patient care with entrepreneurship?
That's a good question. It's, first of all, on the first part of that question, I think the person who is in practice doing something has a tremendous advantage in seeing the problems, the things that you must make practical and for something to work. And so, as in this document I've handed out, there's some things on that, but ideas are all around. They're every day in practice, they're every day in the operating room, and if you just have your radar set, seeing somebody do something a little awkwardly, or you're having difficulty and that instrument isn't quite working, there's an opportunity there to think about something. So I think that enhances the ability to develop something in an area if you understand how the specialty is done and the surgery is done. With regard to the second part, the balancing of a surgical practice or medical practice for that matter and business, it's somewhat difficult. The best thing that I had found that I could do, and I would advise this, is try to compartmentalize your week in some way. It's almost a killer if you just try to practice every day and let this other stuff drop in, because business does not function on the same time schedule as medicine and surgery. I mean, surgery can go late, or you can be behind with patients. There's things that happen. To try to compartmentalize it at first, perhaps say, okay, I'm going to spend every Wednesday afternoon on the project, or I'm going to spend every Thursday, or whatever it is. Try to do that. It won't all work out that way because there are going to be phone calls and et cetera, but try to do that as much as you can. And I think another thing there is try to keep some balance in what you're doing. You can get off on something and let everything else go, and you've got to watch your health and your family life and everything too, to keep them in balance.
Do you have a sense of what kind of balance you're talking about? I mean, you've now got through 5 companies while maintaining a practice. Is it realistic to say you'll set aside one day? Is it really 2 days? How much time did you, over the years, have you devoted at various times to the business side of things? Well, it became progressively more. It's over 8 companies actually. At first, Collagen was the only thing, and then laser scope and Resound overlapped some, so there was that. And then later, there's been more overlap. And now it's decreasing a little, but the overlap, you just have to decide how much you're going to practice and how much you're going to spend on these things. And I think it depends on what you like to do and what you think the prospects are for it. But being in patient care is a big advantage.
Great. Thank you.
Great.
Hi, my name is Jeremy Johnson. I'm a PhD student in electrical engineering. You learned the lesson of loose lips sink ships the hard way during your experience with Splint, and I was wondering if you could describe more about, are there some principles that you use to determine when you speak in detail about a project and when you don't? For instance, the role of the person that you're speaking with on the project, how far the project has been developed, because obviously you can't be too tight-lipped or else the project doesn't move.
Sure. Well, that's a good question, and it's a difficult one to know all the time. My advice there would be, if you have an idea, develop the idea a little in your mind first and get the concept down so you understand it well. I would then probably do a one-page disclosure with somebody else that just says, they don't say that it's your invention, but just read and understood by so-and-so, a date, and describe kind of what it is. And then I would start to develop the idea, but I would immediately, if you think it is going to be a worthwhile thing, go to a good patent counsel and get something going very early, because you establish a date then. Even though you show these early things and engineering books and everything, later that can be a headache and a very expensive kind of thing if there's a problem in two patents issuing about the same time. With regard to what you've done that, I think you can start developing it, but I wouldn't just noise it all around either, because even though you think you have a patent on something, you give a competitor a lot of information if you're telling how you're doing it, and they see and then another way around it. Now, I do think you have to, at a certain point, you have to relate to other people, involve engineers and doctors and the whole team in it, but it's a matter of judgment. I think you want to get it kind of going before you do that.
Thank you.
Right.
My name is Amy Angel, and I'm one of the fellows with the Biodesign Innovation Program. And it seems like a lot of the things you've done, you sort of learned on the fly, especially with business development and starting your companies. And I was wondering if there are any skills that you wish you had before you started, and anything that you can recommend to young engineers or physicians coming up wanting to do similar things, starting companies.
Mm-hmm. Well, I think the skills that I wish I'd had more might have been financial skills, and also maybe learning more about patents and how they're constructed and what they mean and that sort of thing. I've always depended on somebody else kind of to do that. If I were looking back, I would probably, that'd be two things. I think the skills that I did have, that I feel very fortunate to have, I told you about this being the tutor and the cigar box and everything. That was a skill that turned out to be very valuable to me, because I learned how to illustrate an idea simply, clearly, and that has not always worked out that you can do that, but that's another skill, I think. PowerPoint skills would be an equivalent of that now, if you will, but this was, colored chalk drawings and things like that. So the ability to communicate an idea, to rally others around the idea, as the vision leader. You mentioned the sheepdog. We never got to that. The entrepreneur is one who herds resources. They herd technical sources, technical people, lawyers, investors. You try to bring them together and get them to see the common vision. And so the ability to communicate and write well and present well, I think, is a good thing to have in your arrow in your quiver. Okay.
Hi, Bill Overall. I'm a fellow in the Biodesign program at Stanford. You talked about a number of companies here today that have ultimately turned out to be quite successful. And I was just wondering, are there other companies that weren't quite as successful, or have you just had a great track record in being able to pick the right things? And if that's the case, what kind of filter have you used in order to take the ideas that are ultimately going to?
Yeah, that's a good question. It's like, I call it the Time Magazine syndrome. You read Time Magazine, and you'll read this article about somebody who does this thing and everything, and you say, God, how'd they do that? Well, you don't read about all the blind alleys they went up maybe before they got there. Most of the enterprises have been successful, however, all have not been. One that actually, I'm surprised it was the one that wasn't successful. I started a company called Soundport, which we later, a lot of the scientists went to Sound ID. And it was in the implantable hearing aid area. And if there's any area that I think I would have the most advantage, it would be in that area. We had some technology that was very good, but I didn't think it was elegant enough and simple enough. And I thought it would take, and I invested a fair amount of money in that, but I didn't think that, one, it was elegant enough and simple enough, And two, it was going to take, I thought, another $40 million to develop it. And at the time, also Sound ID, the concept was coming on. I liked that a little better too. But then I just hibernated the company. And I think one of the things there, a lesson would be, is knowing when to hold them and knowing when to fold them. Because you can spend tremendous amount of time on something that isn't going to go anywhere. That does not mean that you give up, however. If you believe in an idea, then don't accept failure, just keep going after it.
You said the shiver through the front row here with that.
Yeah.
These are all the Sound ID folks talking.
Well, actually, many of them, not all of them, I mean, some of the earlier ones were at Soundport.
Right.
And then changed over to Sound ID, because we had a nucleus of very good hearing science people in Soundport.
Next question.
I'm Mike Murray, a student with the Biodesign Innovation Program. You've talked or given some examples today of situations where success has come from taking a turn. Maybe you didn't know where you're going to head and something just fell out. Mm-hmm. But at the same time, a lot of businesses are evaluated and recognized for the ability to state a plan and then execute to it. Stick to it. So it seems like those are two competing ways to succeed, either the opportunism of grasping an opportunity or staying with something, staying the course. How do you balance those two? Which would you look for in a management team?
Well, I think when you start an enterprise, you have to have a plan of what you're going to do. But it's as in the recent Gulf War, you have a plan and you see what happens, and then you may have to alter the plan. If the reality of the situation or you see something that is in the way and it's not going to allow that plan to occur, it's probably not a bad idea to do something else that you think you can do. Now, there's another equation there, another thing in the equation, I think. When you get a very bright group of people together, and that's what you want to do, is when you start a project, always hire the best people you can and get the best people, because everybody wants to join the A team. If you have a bunch of BCs, you don't get the A's joining the team. So if you get the A team together and there's a bump in the road or an alligator instead of a log that you're stepping on, the A team frequently can be very quick in figuring out something else to do, or some way around that, or some other way that can be effective. And so you do have to balance it. When you're talking with VCs, any complexity makes them nervous. You want to create a very straightforward one product, and you're going to sell it to a known market. And this is the development risk, and this is the regulatory risk. Things are really understood. If it's very complex, not that, they might not understand the complexity, but they don't like complexity. So you have to have a plan that you go for it. And you should follow through with the plan that you're professing that you're going to do. But if you do hit a bump in the road, it would be foolish to continue that and go off the cliff if you think that's going to happen. Thank you.
Thank you. Any other questions? Rodney, thank you very much.
Thank you.